Good evening, everyone. My topic for today's presentation is okay. Okay. Hello. Good evening, everyone. My topic for today's presentation is my experience of brolucizumab in a case of idiopathic CNVM. I have no financial disclosures and conflict of interest. So, my patient, 25-year-old male and associate in consulting firm by occupation, presented in OPD with a chief complaint of diminution of vision, left eye, 6 months. He had no any past history of systemic illness or any medication or any history of trauma. Patient was previously diagnosed as a case of idiopathic CNVM with SRF in left eye, diagnosed elsewhere, for which he had received intravitreal bevacizumab there. So on examination, a BCV of 6/6 in right eye and 636 in left eye was noted. Rest all external findings were within normal limits. Fundoscopic evaluation revealed a dull FR, probably a idiopathic CNVM with big SRF and PED. So OCT evaluation confirmed the presence of CNVM and SRF. Patient was somehow not satisfied with the previous treatment regime and wanted to go for the best options available with us. So we advised him to go for intravitreal injection of brolucizumab, and monthly follow-up was advised. So 3-month follow-up after the first dose, BCVA left eye still 6/36, but anatomical improvement seen. SRF has decreased, PED still remains the same. Now 3-month follow-up after second dose, the BCVA 6/18 with near complete resolution of SRF. Patient was advised to go for the third dose, and after the third dose we can see there is complete SRF resolution. CNVM is still there. So 3 intravitreal injections of brolucizumab were given at an interval of 3 months each between injections, achieving a final visual acuity of 6/6. Hence we conclude that intravitreal injection of brolucizumab has a good resolution in cases of idiopathic CNVM with SRF non-resolving with other molecules. This is the fundus pic of the patient after giving after 3 doses of brolucizumab. So something about brolucizumab is a humanized monoclonal single chain fragment that binds with VEGF-A, has a molecular weight of 26 kilodaltons. By attaching to VEGF, brolucizumab inhibits the activation of VEGF receptors, decreases neovascularization in the eye. It is currently FDA approved for the treatment of neovascular ARMD and has a T-half of 3 days. It readily penetrates the RPE choroid, and the serum concentrations is less than 6,000 times than that of the vitreous concentrations. That is all. Thank you, ma'am.
What was the drug you were using before brolucizumab? Bevacizumab. Okay. So you said he was somehow not satisfied. That is nothing. Did you have an indication for shifting the drug? Did you have an indication? He said is not the question. You have to decide. Yes.
Center from where we had
Yes.
there the recorded visual acuity was 636, and after the injection also the recorded visual acuity.
Visual acuity may not change. Point is, was there any evidence of activity, fluid, RP detachment, which was not resolving with bevacizumab? Do you have any such evidence before you shift to brolucizumab? So don't shift a patient to a potentially risky drug, which can cause blindness, based on without having any evidence of lack of efficacy.
Brolucizumab has a problem of intraocular inflammation. Moreover, when you shifted to Pagenex or brolucizumab, you said that you have given the injection at 3 monthly interval. No. CNVM. So, why didn't you give the loading dose of 3 injection? You could have got a better result. 1 month loading dose as per Harrier and Hawk study, and then 3 monthly.
So first thing is, you should have had evidence of inefficacy of bevacizumab, which you don't have. Second is, then there are other drugs to shift to, like ranibizumab, like aflibercept, and then you go to brolucizumab if at all nothing is working, which is very rare. No, post-bevacizumab. He has used post-bevacizumab.
No, the patient was already on ranibizumab.
It was an idiopathic CNVM, sir. He was a young boy, associate in a consulting firm, sir. I agree with yes, sir.
Yes. Might, yeah.
Okay, sir. Okay, sir. Yes, yes, sir.
माइक तो दे दो जब कोई बोलता है तो. Not even listening. Yeah, so if there are any questions from the audience, anything at all related to the last session? Nothing, okay. Anybody comments, anyone? Okay, thank you very